Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. I'm also a nurse educator. In this video, I'll be going over 5 fundamentals or foundations NCLEX style questions. While caring for a client in a rehabilitation center who has self-care deficit related to bathing and hygiene, the nurse assists the client by finding loose clothing to wear that snaps easily in the front. By the way, this is how you spell loose. I see a lot of times when people are spelling loose clothing and they write it as L-O-S-E, and that's lose. When you lose a competition is L-O-S-E. Which of the following best describes the rationale for this? Loose clothing that snaps easily in the front. Loose clothing is easier to remove so that the client may be more likely to change clothes. The client would be more comfortable wearing these type of clothes. We're going to go with functionality. They're easier to remove. That's why we also put the snaps in the front so that they can reach them. A client with self-care deficit may benefit from wearing loose-fitting clothes that are easily undone. You can pause to read more. Nursing.com has videos in case you need to review the subject matter. A client is taken into the operating room and placed in a prone position. The nurse knows that the client is oriented in which way. Prone is face down, so they are on their abdomen. Prone is face down, so they are on their abdomen. A nurse is reviewing labs on an unconscious client who arrived to the emergency room. Which of the following abnormal lab values would make the nurse suspect a traumatic crush injury? Normal sodium is around 135 to 145. pH is around 7.35 to 7.45. Potassium is 3.5 to 5. So with the potassium being elevated indicates hyperkalemia. This is a common result of severe crush injuries because the cells get crushed and push the potassium out of the cell into the bloodstream, causing high potassium in the blood. And 9 is a normal calcium level. A client attends a routine physical exam at a primary care clinic. The client tells the nurse about wanting to start using complementary therapy to support health. Which response from the nurse would be most informative about complementary therapies for this client? Complementary therapy to support health. This is the best option. There are a number of options available for complementary therapy. Let us know what you decide so we can tell if it interferes with your regular treatment. Complementary therapy is designed to be used in conjunction with standard therapy, not as an alternative. You can pause and read the other rationales at your convenience. Make sure that you hit the like button. Make sure you can press that subscribe button. It helps me out tremendously and it helps other students find my channel. Thank you. Have a great day.